The idea of a colonoscopy can be scary, but with more people being diagnosed with colon cancer at a younger age, researchers have found new, less invasive ways to detect the disease. Katie LaSalle recently talked to a woman who knows firsthand the importance of detecting colon cancer early.
March is Colorectal Cancer Awareness Month, and joining me now is Kendra Mitchell. Kendra, thank you so much for taking the time to share your story with us today. You were actually diagnosed with stage 1 colon cancer at a relatively young age, at 34. What kind of symptoms did you first experience?
Well, as a busy young person and all the things that I had, fatigue, changes in my, bowel habits, loss of appetite, sleep, all these things, I just attributed to my lifestyle and working hard and being, young. And so definitely listen to your body. It's trying to tell you something.
This must have been such a life-changing diagnosis. What kind of treatment did you have to go through?
Because again, I had a team of wonderful doctors who knew where to send me. I didn't even know what a colonoscopy was. But because of that and the education that they took into knowing when to catch the signs and that early onset was on the rise, I caught mine at stage 1. So I had to have surgeries. It wasn't easy, but I was able to skip the chemo and the radiation and a lot of the things that people have to go through when they're caught at later stages. So it's just really important for me to talk about catching things early and that it is treatable and beatable for sure.
Unfortunately, not everyone is so lucky. So let's talk more about detection and possible prevention. Screenings, they're something that are very important and can save lives.
Absolutely. Anytime you have any changes in your body, especially in bowel habits, blood in your stool, I had as well. We often are afraid of that and don't want to get it checked, but it's really simple. You can do at-home tests now that will tell you if you have blood in your stool. There's all kinds of new technologies coming out, and we're able, because of the better scopes and things out there and all the doctors educating each other and the industry really, we're able to catch things much earlier. So I'm kind of living proof of that.
And with colon cancer, there are many factors you can't change, like you mentioned, family history or age. But are there things people can do to mitigate risk, maybe like quitting smoking or heavy drinking?
Yeah, I think all of that plays a role, as well as, living an active lifestyle. I know that a lot of times I had spent traveling and, sitting on planes and in offices and things like that. And it definitely, contributed. Stress levels is something that I think is newly being researched. And I know that was a factor for me. So I just think in general, living that healthier lifestyle has been a big contributor to my success in the future.
And Kendra Mitchell, anything else you'd like to share with those watching, just based on your journey? And you've gone through so much, and you're really lucky to come out. But early detection, that was
Yes.
a big part for you.
That was a big part, have that active conversation. It's hard to be your own advocate, but I would say that's the biggest thing in life, as well as in your healthcare. Really, if no one wants to listen, you need to find someone to make them. And you really should be educating yourself on what tests are out there and what those signs are, really for any health related issues, but especially colorectal cancer, because it is on the rise in young people, unfortunately.
Kendra, thank you so much for your time today and sharing your experience.
Yes, thank you so much for having me. Appreciate it.
And thanks to our partners at organizations like the American Cancer Society, we have more information on cancer prevention on the Your Health Matters page of thedenverchannel.com.